veggies and exercise aren't enough. You've undoubtedly heard of the tried and true methods for decreasing your risk of heart disease and stroke. Stop smoking, reduce weight, exercise, and lower your blood pressure and cholesterol. Recent research, however, has shown several novel preventive strategies. Here are 5 unexpected methods to maintain the health of your heart and blood vessels. Number 1. Stay away from the highway. According to a new study that discovered a link between traffic noise and the risk of stroke, the sound of horns, sirens, and loud vehicles may take a toll on your blood vessels. The findings, based on surveys of over 51,000 adults in Denmark, revealed that every 10 decibel increase in noise level raised the risk of stroke by 14%. The risk of stroke increased by 27% for individuals over the age of 65. According to the researchers, exposure to loud noise may increase stress hormone levels in the body as well as blood pressure, which may lead to an increase in stroke risk. The findings were reported in the European Heart Journal on January 26. Previous studies have similarly connected road noise to an increased risk of heart attack. Number 2. Make sure you get enough sleep. A recent study published in the European Heart Journal showed that getting too little or too much sleep may raise the risk of heart disease and stroke. The results indicated that individuals who slept 6 or less hours per night had a 48% higher risk of getting or dying from heart disease, and a 15% higher risk of developing or dying from stroke than those who slept 7 or 8 hours per night. According to the researchers, not getting enough sleep may raise blood pressure and cholesterol levels, as well as put people at risk for obesity and type 2 diabetes. However, the study found that obtaining too much sleep was also harmful for the heart. Those who slept for 9 hours or more had a 41% greater risk of developing and dying from heart disease than those who slept for 7 or 8 hours. Number 3. Eat blueberries. According to a study published this month in the American Journal of Clinical Nutrition, eating blueberries may reduce the chance of developing high blood pressure. According to the study, people who ate at least 1 serving of blueberries each week were 10% less likely to acquire high blood pressure than those who ate no blueberries. Over a 14-year span, the researchers examined the diets of 134,000 women and 47,000 men. They looked at how much anthocyanin, a kind of chemical, the subjects ingested. Anthocyanins are antioxidants present in foods such as blueberries, blackcurrants, blood orange juice, and eggplant. The research participants who consumed the most anthocyanins in their diets had an 8% reduced risk of high blood pressure than those who consumed the least anthocyanins. Number 4. Avoid diet soda at all costs. According to a recent study, drinking diet soda may raise your risk of stroke. The study, which included 2,564 individuals, discovered that those who drank diet soda on a daily basis had a 48% greater risk of stroke and heart attack than those who did not drink any soda at all. The findings were consistent, even when the researchers controlled for characteristics that might impact heart disease and stroke risks, such as whether the patient had metabolic syndrome or a history of heart disease. However, the researchers emphasized that the study only found a correlation, not a cause and effect relationship. The findings are preliminary, and additional study is needed to support them. The research was presented at the American Stroke Association's International Stroke Conference in Los Angeles on February 9. Number 5. Eat dark chocolate. Several studies indicate that consuming dark chocolate may lower your risk of cardiovascular disease and stroke. A research presented last year at the American Academy of Neurology's 62nd Annual Conference discovered that among 44,000 participants, those who ate a weekly dose of chocolate were 22% less likely to develop a stroke than those who did not eat chocolate. Another study discovered that those who ate 6.7 grams of dark chocolate per day had lower levels of a protein in their blood that is linked to inflammation. Other study indicates that eating chocolate may help decrease blood pressure, inhibit the formation of arterial plaques, and enhance blood flow. The advantages of chocolate may be due to flavonoids, which are chemicals found in chocolate that are considered to help protect cells from harm. Dark chocolate contains a greater concentration of them. Another recent study discovered that dark chocolate aids in the inhibition of an enzyme known as ACE, which is important in the regulation of blood flow. Blood pressure is reduced when ACE is deactivated, and certain blood pressure medications explicitly target the enzyme. Thank you for watching. Please like the video, share and subscribe.